Andrew, I want to jump to you and talk a little bit about how GO2 is moving forward and what we are seeing during this time.
Some of the trends we've noticed that Jennifer and Amy were mentioning about research adapting in clinical trials, adapting to the new kind of situation and trying to help patients in the best way possible. We become aware of that, and we really wanted to make sure that we could be a resource to the patient community, and we did that through our LungMATCH program. And I think just for everyone, LungMATCH is our kind of clinical trials treatment and molecular testing navigation program in which we have patients can call our helpline or they can email our support at go2foundation.org email address. And really, we help people get access to molecular testing, answer their questions about clinical trials, and answer their treatment questions. And I think, there's a lot to sort through at the best of times. And now, with all the changes and adaptations we're seeing because of the COVID situation, we're trying to stay ahead of that as an organization and as a program and kind of keep our ear to the ground and hear kind of like the practical things that are happening to patients and pass that information on so that patients know what to ask their doctors and, they can be aware of some of those changes. One of the most important sources of information we've gotten during this time is just from patients sharing their stories, and we've kind of come up with some of the trends. And I think, what's really hopeful is that we're hearing that, in some cases, patients are still able to enroll on clinical trials relatively normally. And, during this time with kind of minimal impact how they would normally do that. We talked to a patient just last week who was screened for a clinical trial on Thursday and is going to go for actually their first protocol treatment on the trial tomorrow on Wednesday. And really, the only changes they've had to make is the clinic is taking increased precaution to make sure that they reduce their risk from exposure to the virus. And unfortunately, the family and loved ones that normally attend appointments with them won't be able to attend to kind of reduce that risk, but they're still able to join. It's a once weekly infusion, and they're still able to do that. What we're hearing, though, is that can be location and actually sometimes clinic dependent. So where you are may affect, as Jennifer was talking about earlier, different areas of the country are being impacted at different levels by the virus at this moment in time, and that may be reflected. We also talked to another patient earlier this month who tried to join one of the larger, earlier stage clinical trials, the Alchemist trial, which is looking at targeted therapy to use for stage 1 to 3 non-small cell lung cancer patients after surgery. And their center actually was not currently enrolling patients onto that trial. They told them that they would kind of be calling them at 1 month intervals to see if that had changed and if they could enroll. But it just goes to show that while some people are able to join, some clinics are not actively able to enroll. So having to keep in mind that, some of this is location dependent. And that's one of the things we're trying to keep abreast of as a LungMATCH team is when patients call us, what have we heard about locations that are enrolling normally and want to pass that on. But the other thing we're also hearing is that from the patients, that there's a lot of changes in the adaptations clinical trials are making for patients that are already a part of a clinical trial to kind of reduce their risk of exposure to the virus and make sure that, they have the safest experience possible. And some of the things that Jennifer and Amy were talking about in terms of telemedicine, mobile phlebotomy, and things, we're actually hearing that that's already, being implemented for individual patients on individual trials. And it can vary to the degree of which it's being done. For instance, we talked to a patient earlier in the month who was able to get a lot of these adaptations made to reduce the amount of times they had to go to the clinic for the clinical trial they were already enrolled on. But it required a lot of kind of upfront effort on their part, a lot of kind of stress and calling a lot of individual partners, the clinical trial doctor, local resources. But what they were actually able to set up is the clinical trial is now sending them the trial drug. It's a targeted therapy directly to their home and making sure they receive the doses, following up with them. They were actually able to arrange for a mobile phlebotomist to come to their home to actually draw the blood so they don't have to leave home as part of the clinical trial. And they were able to set up telemedicine visits with the trial doctor. So for regular check-ins, they can just do that instead of going to the clinic. They told us they still have to go in for certain CT scans that are required as part of the clinical trial, but that they've managed to implement that so that they get everything that they need to be done at one appointment. They don't have to go in as often to their cancer center. Now, sometimes that varies. We've also heard there's some clinical trials that are actually kind of reaching out and setting up a lot of these things for the patients. We talked to a patient who was on a different clinical trial, and the trial actually reached out with a plan in place to switch over. They set up telemedicine visits for them. They had to have the drug mailed to them, which they helped set up. And also, they switched over a lot of the resources, such things as the scans and the blood draws they needed, to be more local to them so they wouldn't have to go to the cancer center they normally go to, where there are a lot of patients. They might be at risk for being exposed to the virus, but they set up the blood draws that were required for the trial to be done at a local kind of LabCorp facility like a Quest Diagnostics, which had a lot less people. And also, they were able to set up the CT scans, which would normally be done at the cancer center, through a local outpatient imaging center, which had a lot less people at it. So most of the things they were able to stay at home for, and other things they could go locally. These adaptations are happening relatively quickly, and they're being made to help these patients. So we're trying to keep track of that and just pass that on. And there's, a lot of good news to share.